Steve, what challenges do patients with familial chylomicronemia syndrome face?
So probably we can break this into three aspects. The first is diagnosing it. Ultra rare condition, perhaps 1 to maybe as high as 6 to 8 people per million individuals have FCS. So it's ultra rare. So that's an issue because many doctors won't know about this disease, won't know how to diagnose it necessarily, and won't know about treatment modalities or options. So diagnosing it is the first challenge in FCS. So the more we can make people aware of this disease, both from the patient and family side and physician side, as well as dietitians, folks who may play a role in the care of these patients, the better that would be. Symptoms can be, as you've mentioned earlier, it can be everything from memory issues and this kind of foggy brain issues that patients will describe. It can be recurrent or chronic abdominal pain, all the way to having pancreatitis. So the symptom burden is very high, and that's also a challenge for these patients with FCS. And then the third aspect is treatment. We don't have any FDA-approved treatments for FCS. We manage this essentially with trying to minimize how much fat these individuals take in, and they are on an ultra-low fat diet, so much less than 20 grams of fat per day. This is very difficult for these patients to follow, and it affects, as you can imagine, your ability to go out, to socialize, where many things are around food and meals. So these patients, they don't have effective therapies, super low fat diet, and that all makes this challenging for these patients. And as these patients, they have symptoms, it really does impact their life, and there's a social burden that's associated with this that's extremely challenging.
I agree, Steve, and what I have also seen with my patients is that they're always concerned that at any second they can develop an episode of pancreatitis. They may eat something that they don't know exactly how much fat they may be, and it may trigger pancreatitis. As you were saying, the social burden, it's very important as well, because I frequently hear the family wants to go on vacations, they want to go on a cruise, they want to do something fun, but they're very concerned about going out and getting sick. So it affects the patient, it affects the entire family.